Hi guys, hope you're all well. This is the last. Today we'll continue with the anatomy series. Okay guys, let's start. Guys, today we'll be studying a very interesting bone. Which bone is it? Guys, can you see two images here? One is like a pin, one is like a bone, isn't it? So the bone is very similar to a pin. This is a pin-like bone of the lower limb, which is called the fibula. Okay, this is the fibula. See here, it's a pin-like bone of the lower limb. It is present. It is a very thin bone present on the lateral aspect of the leg, and it has primarily muscle attachment providing function. See, if you take bones of the leg, the skeleton of the leg looks like this. This is of a right leg, right tibia and right fibula. Okay, they articulate like this. So whenever there is weight put on this, the main weight bearing function is done by the tibia. And the fibula is important because it provides the attachment for muscles of the anterior, lateral and posterior compartment of the leg. Okay, see here I have an image of the tibia here, the fibula. So you can see here almost the bone is covered by muscles here. Okay, the lower part is usually covered by ligaments. This is covered by muscles. It's completely covered, and only some parts of it is subcutaneous. So it is providing a muscle attachment providing function. Okay, what is the site determination? See guys, now let's just briefly see the parts of the fibula. It has an upper end or the head and neck to form the upper end, the shaft, and the lower end or the lateral malleolus. These are the parts of tibia. So how do we hold a tibia in anatomical position? See, it's easy to identify the lateral malleolus because it has a facet here and it has a groove here. It should come down and the upper end should come up. Then see, this facet is for talus bone, which is forming the ankle joint. Ankle joint is medial to that of the fibula. So this should come medially. Okay, so this is a groove here. So put the finger in this malleolar fossa. Okay, see the way I am putting the finger, like this. This facet should come anteriorly. So hold it like this. So this is a right fibula. Upper end up, lower end down. Shaft. Okay, upper end up, lower end down. Put the finger in the malleolar fossa. The triangle should come anteriorly. See, if I hold like this, the triangle will come posteriorly. So this is not the side. So this is the anterior. It should come anteriorly. This is the right fibula. Okay, these were the parts. Now let's go to the features of the upper end. Upper end of fibula. This bone, the upper end is broken. If it was intact, it would have a head and a neck here. So a head has facet for articulation with the tibia, isn't it? This is the tibia. So see, on tibia also you can find a facet for articulation of fibula. So it will be like this. Okay, it will be articulated like this. So that was the head. Then neck of fibula is very interesting because there is an interesting nerve going there. There is a common peroneal nerve. The sciatic nerve comes, tibia, it divides into tibial nerve and common peroneal nerve. Common peroneal nerve comes like this and winds around the neck. So how is it important? If we have a blow here and there's a fracture of the neck of fibula, there's a chance that the common peroneal nerve will get damaged. That will cause foot drop. We'll study in detail how. Okay. Now let's go to the features of the shaft. That were the features of the upper end. Hope you understood that. Okay, if you have any doubts, please post it in the comment section. Now this is the shaft of fibula, isn't it? It has three borders and three surfaces. Which borders? See, the anterior border. This is the anterior border. This is the interosseous border, and this is the posterior border, which is behind. See, and there are three surfaces corresponding. Anterior border, between anterior border and interosseous border is the medial surface. Between anterior border and posterior border is the lateral surface. And between the interosseous border and posterior border, which is behind, is the posterior surface. Okay, got it now? Three borders, three surfaces. You can use this triangle if you like. See, anterior border, posterior border, interosseous border, medial surface, lateral surface, and the posterior surface. Got it? Now let's go to the features of the lower end. Lower end of fibula has a lateral malleolus here. This is the lateral malleolus. Okay. It has four surfaces: the anterior surface, posterior surface, medial surface, and the lateral surface. The lateral surface is subcutaneous, so you can palpate it in the lateral side of ankle. The medial surface has a articular facet for talus bone. Talus bone is also a part of ankle joint, isn't it? So that is also forming the part of lateral the medial side of lateral malleolus. This is the facet, and here is a groove. This groove is for peroneus longus and peroneus brevis muscles. We'll be studying that how. Okay. Now joints formed by the fibula. See here. See, you hold it like this now. This is how the skeleton of the lower limb, the leg is there now. Just can you see this? How many joints are there? See, there are superior tibiofibular, middle tibiofibular, inferior tibiofibular, and along with the talus bone they form the ankle joint. So those were the joints formed by fibula. Now let's go to the attachments. See guys, you can use this table, it would be easy for you in revising. See, let's start with the surfaces. The medial surface, it hosts muscles of the extensor compartment. Which are the muscles of the extensor compartment which extend the foot? The extensor digitorum longus, extensor hallucis longus, and peroneus tertius below. See here, this is the attachments on the medial surface. The extensor digitorum longus, like this, it's upper 1/4 and middle 2/4 surfaces, and the extensor hallucis longus from the middle to 4 anterior border, near the anterior border, and the peroneus tertius muscle which is below. Extensor digitorum longus, extensor hallucis longus, peroneus tertius. Those are the muscles of the medial surface. Now, the muscles of on the lateral surface, which are gaining attachment on the lateral surface. The peroneus longus muscle, upper 2/3, peroneus brevis muscle, lower 2/3. How the middle 1/3 compensates, you can see here. Near the posterior border is the peroneus longus, anterior border is the peroneus brevis. See, peroneus longus upper 2/3, peroneus brevis lower 2/3. Okay. Now let's go to the posterior surface. The posterior surface hosts 3 muscles: the tibialis posterior, soleus, and the flexor hallucis longus. Extensor hallucis longus was from the medial surface. Okay. Flexor hallucis longus is from the posterior surface. You can see here now. This is the posterior surface. The posterior surface is providing attachment for the soleus muscle in the upper part, the flexor hallucis longus, and the tibialis posterior, flexor hallucis longus, and the soleus muscle. Near the head, posteriorly, there is attachments of biceps femoris muscle, which is of hamstring. So it comes and attaches to the head. Okay, the fibular head. Then there is here you can see the images of peroneus longus and peroneus brevis. They both muscles take origin from the lateral side, come like this, and go to the foot. Okay, we'll study that in detail when we are studying the foot. Now, the borders. What are the attachments of the borders? Guys, see here in anatomy, what happens is usually surfaces give attachment to muscles and borders give attachment to ligaments. So the anterior border provides attachment to these ligaments. Just see, there are 3 borders now. Leg has 3 compartments. So the anterior border gives anterior intermuscular septa, posterior border gives posterior intermuscular septa, interosseous border gives interosseous membrane. See, you can find the attachment anterior intermuscular, posterior intermuscular, interosseous membrane. So anterior border additionally has 2 more ligaments. Simple. Anterior intermuscular septum will be there. Along with it, there will be superior extensor retinaculum, superior peroneal retinaculum. We will study them in detail. Anterior intermuscular, superior extensor, superior peroneal. Now lateral malleolus, what are the attachments? Simple guys. There are 3 simple and similar ligaments. The anterior tibiofibular, interosseous tibiofibular, posterior tibiofibular. There are 3 connector, tibia and fibula. And there is capsule, which is sauna, the joints. The inferior tibiofibular joints is the synovial joint, will have the joint capsule. And there will be calcaneofibular ligament between the fibula and the calcaneum bone in the foot. Okay. Now head gives attachment for biceps femoris, and it is also giving attachment for the superior tibiofibular joints capsule. Now what is the clinical significance? Why are we studying this? I see here, fibula, there is not many important neurovascular structures around the lower part of fibula, isn't it? So sometimes what happens, the orthopedic surgeon or any other surgeon would require bone graft. They would take bone from certain part of the body and put it in another part of the body. So during that procedure, the fibula is very much preferred. Okay, and there is an injury to the common peroneal nerve that can cause foot drop, because common peroneal divides into deep peroneal and superficial peroneal. Superficial peroneal supplies the lateral compartment, deep peroneal supplies the anterior compartment. So if those both are paralyzed, foot will drop like this. This means due to overaction of the flexors. So this is known as the foot drop phenomenon. And there is one more. In leprosy, during its pathogenesis, in later stages, there can be nerve thickening. The nerve will become thick. One of the nerves palpated for during leprosy examination is the common peroneal nerve and ulnar nerve through, and the nerve trunks get thick basically. So that was the importance of the common peroneal nerve widening around the neck of fibula.